So hepatitis simply means inflammation of the liver. A term for the liver is hepar. And when the liver is inflamed, we call it hepatitis. It could be due to a medication, it could be due to alcohol, but very commonly it is due to a virus or a number of viruses. And the viruses actually are the alphabet: hepatitis A, B, C, D, and E. The ones in the middle, B, C, and D, can lead to chronic liver disease. So the difference between chronic liver disease and acute liver disease is that in acute liver disease, the patient gets a liver condition, there's inflammation, they may or may not have jaundice, yellow discoloration of the eyes and the skin, and then they usually get better. It never leads to chronic liver disease. So hepatitis A and hepatitis E never lead to chronic liver disease. But the ones B, C, and D can lead not only to acute liver disease, but then instead of the patient recovering, they're saddled with these viruses, often for life. There are roughly 400 million people in the world afflicted with chronic hepatitis B virus affliction, and an estimated 200 million people in the world with chronic hepatitis C infection. So if you add those up, more than 500 million people in the world are saddled with either chronic hepatitis B and C. Now, fortunately, there are a number of prescription drugs that we can use both for hepatitis B and for hepatitis C. In hepatitis C, we use a combination of two medications, peg interferon and ribavirin. These have to be prescribed, and the patient has to be taught on how to administer the self-injection of the interferon known as peg interferon. It's usually done by a hepatologist, a liver specialist, some occasions by an infectious disease specialist. These medications may have to be taken for 6 months or up to a year. So this combination of peg interferon and ribavirin have to be taken for up to 6 months to a year. And what's really dramatic is that 40 to 50% of patients are actually cured. This is a radical term that we use in medicine for a chronic viral infection. It's the only time we use it. Patients are actually cured. There is no trace of the virus in the blood. There's no trace of the virus in the liver using very sensitive, sophisticated molecular probes. In contrast, in chronic hepatitis B virus infection, we cannot eradicate the virus, but we can suppress it. And suppressing the virus can change clinical outcomes. It may decrease the need for liver transplantation, the risk of liver cancer, and so it is still a very dramatic effect. And the medications that are commonly used to treat chronic hepatitis B, the prescription medications, include lamivudine, entecavir, adefovir. Those are some of the common medications we use to treat chronic hepatitis B.